When we thought of New Hampshire, we think of New Hampshire, the New Hampshire way. Like, it was very interesting at the beginning as to why they had done the partnership exchange as opposed to the state exchange. In one of their Senate bills, they decided not to do the state exchange, instead doing this balance between the federal government and the state. And so that was surprising to us at first, but as we learned more and more about the state, we understood more like what they were doing, kind of thing. The Medicaid expansion, for instance, they didn't go through with the traditional Medicaid expansion like other states had. What they're trying to do is use their federal money to expand private coverage in the state, which is a couple of other states are trying to do it, but it's not exactly what the funds were intended to do, but it's also a very interesting approach. So seeing how that unfolds and how many people get coverage in the state, that's an example of like what we mean by a wait and see approach. I started off with people because I'm a people person, and I had done in my classes lots of research contacting other states, calling offices, getting information, interviews, things like that. The New Hampshire State Exchange Board, for example, I went through and I found who these people were, what their backgrounds were, looked at their LinkedIns, like who they were and what they brought to the table policy-wise. So I did that. I also did a lot of work on the outreach and the education, looking at to see who was funding the marketing, the communications, and things like that. I love my major, health policy management, so anything, internships, any opportunities I can get, I seize them right away. And this was just like a national project, so I was excited to learn as much as I could about the ACA, really get my feet on the ground and meet the people, do the research, and so. As far as like the outreach goes, they received federal funding to do the outreach and education for the state, but they opted, instead of they had like a state bill that prevented them from accepting the funds, so they sent that over to a private vendor who is supposed to be doing outreach and will like see how that goes in the future, kind of thing. As for like their numbers, I think they had like 29.3% of individuals who were eligible for the exchange insurance. They received coverage and like signed up for the exchanges, compared to like the national average of 28%. So overall, they're online where they're supposed to be, but it's interesting because they have a balance of Republicans and Democrats in the state, and they're working to compromise, which is really one of the takeaway points, is watching the state compromise, especially with the Medicaid expansion. They have this new way of doing it that they're trying to get passed, and we'll see where we go from there as far as getting people covered. There's still like a lot to see what happens in the future with the shop exchanges, because small businesses are such a big part of New Hampshire, and the shop exchanges coming in 2016, seeing how many more people get covered through those, how the businesses react, kind of thing. So they're definitely, it's very early stages, obviously, with this just starting, but they're right on par with signups, which is huge, huge in the state. And also their state has the partnership exchange compared to the, like say like the Rhode Island exchange has the state-based, and funding-wise, like I don't think they're in like nearly as much debt as some of the other states are seeing. So this is like hands down like the most amazing opportunity that PC has, like I've got through PC. Working with the two professors, learning so much about their work, like editing my professor's papers, my professor's editing mine, like working as a team, like it is an experience like no other. So in the process of doing this, I thought I wanted to go to med school. And in doing this, I realized that no, that's not what I want to do. As a pre-med and health policy management student, I realized that health policy is where I want to be. So that was like a game changer for me. The experience inspired me to do research of my own. I wouldn't have had the confidence before this experience to do an independent study. I've been working on a year-long independent study with Dr. O, who is one of my co-authors for the project. And so I'm doing a whole research, IRB-approved experiment for my independent study on access to care in Rhode Island. And I just took the lead on that one, and I wouldn't have had the confidence to do that or apply to my PhD program without this experience. So it was definitely the most rewarding experience here I've had at PC.